how much would you say the outcomes of treatment are influenced by the time of diagnosis or stage of disease? Also, are there general preventative practices that would reduce the risk of cancers in the general population? By the way, I'm just taking the questions from the chat box, so if you'd like to follow, around 11:22 is where I am now. So Dr. Aisha, and let me know if you'd like me to repeat the question, because it was quite a long one.
Thank you very much. I think if I understood the question rightly, it's saying that what's the relationship between the stage of the disease and outcome?
Yeah.
So I think generally speaking, the earlier the stage, the better the outcome. The later the stage, the worse the outcome, assuming both patients have the same kind of treatment, or rather, assuming both patients are able to access the available treatments. So prognosis, or rather the outcome, is usually worse as the cancer progresses. So if a patient comes to the hospital with stage 3 cancer, meaning not stage 1, not stage 2, person has gotten to stage 3, then the outcome is usually poorer than somebody who arrives the hospital at stage 1. I think just in general and for want of time, that is the simple explanation. I actually picked up some other things in the chat box, which I will just quickly address for time. Somebody was talking about cooking in the microwave and also certain foods. Yes, cooking in the microwave has also not been directly linked to any cancers, even though, just like we explained with the suya, with the canned foods, I said suya, that's the grilled foods, these carcinogens have not been substantive enough or proven to cause cancer. So it also goes into that category. And someone was asking what is the best form of cancer treatment, because chemotherapy, I'll leave that to Dr. Abdulazeez to answer. But for us, we know that there is no best form of cancer treatment. There's no single form of treatment that is adjudged best. It depends on so many factors. It depends on the type of cancer. For example, in gynae cancers, that's what I call women cancers, sometimes chemotherapy is the best option for a particular cancer. Sometimes chemotherapy is not an option for a particular type of cancer. So it depends on the type of cancer. It also depends on the stage of that cancer, if it is a primary one or a metastatic or recurrent one. And there are numerous new treatments coming up. So it is impossible to say this is the best form of cancer treatment. So that will depend on so many things. And somebody asked if it's hereditary, that has been answered. Somebody also asked about breastfeeding. Note that the risk factors I talked about generally are just in general. There are specific risk factors that are attributable to specific cancers. And it's not possible to go through all of it because cancers can occur in every part of the human body. And the risk factors for these cancers could differ, even though we know largely there are some common predispositions to cancer. So for example, breastfeeding, of course, the longer a woman breastfeeds, then that single act can reduce her risk for breast cancer. However, you can still see a woman who has breastfed 14 children still coming down with breast cancer. That doesn't mean that it takes away her risk completely, but it reduces the risk in general of developing breast cancer the longer one breastfeeds. There are also numerous other things that can reduce one's risks of breast cancer and other cancers, but we didn't go into those details for want of time. Then there is this general belief about, I don't know, it's commoner with Nigerians, probably, where people don't even want to talk about it. Okay, why not come, let's test this. Just let us find out if this growth in your body is cancer. And somebody begins to tell you, I was be lie, it's not my portion, I'm not going to have it. So this is also one of the things that causes late presentation. And by the time the woman eventually, or the person, submits himself for diagnosis, it's probably late because the cancer continues to grow. It doesn't stop growing. So I think we should also try to, should I say, disabuse our minds from that I'm not wishing you bad, just come test. If it's not the one, then you're reassured. And if it is the one, then it's still good news because you're probably coming at an earlier stage than you would have presented if you delayed. So those were just some of the things I got. Yeah, someone also asked about sugar and fried foods. Yes, sugar is actually a big thing. Everybody talks about sugar and cancers, but really science has not proven that taking sugar increases your risk of getting cancer, or stopping to take sugar because you have cancer actually improves the cancer or cures the cancer. I don't know if that's explicit enough. But as I have reiterated, taking sugary foods, sugary drinks, lots of sugar, lots of refined foods will predispose one to obesity, and then obesity can actually predispose one to getting cancers generally. Same thing with fried foods. It is not proven that fried foods causes cancer. However, taking lots of fried foods or junk foods will also follow the same path of predisposition to obesity. Those are the bit of questions I will pick up from the chat box. Thank you.